As Methodist Fremont Health was preparing to apply for this acute stroke ready certification through Joint Commission, the recommendation is for the CT result to be read within 45 minutes from when the order was placed. To meet this goal, we had a baseline data of 57% of these were met as of 2021. For the goal for July of 2022, we were going to set that at 75% met. When the time limit is met, it allows for protocols in place to be followed through by the physician for the best health outcomes of the patients. Specifically, timely administration of TPA when indicated, and also timely transfer of patients to stroke centers for definitive care. TPA must be given within 3 hours, sometimes a limit of 4.5 hours of onset of stroke symptoms. Intervention for large vessel occlusion must be done within 24 hours of symptom onset at an interventional stroke care center. After review of the past data sample from May 2020 to March 2021, 53% of the cases did not meet the 45-minute time limit. It was identified that both CT without contrast and CT with contrast are ordered simultaneously within the stroke order set. CTA is completed, which contains a CT head without. Therefore, the CT head without is not considered a separate test with separate results. This is resulting in longer radiology read times.
Well, we got together with the emergency room. All of us frontline workers got together and realized the CTA orderable that the physicians were putting in, it contained a without head and a CTA. And to complete a CTA, it takes a lot of time, and it takes a lot of time for the radiologist to read. So we were falling really short and weren't getting that cutoff time. The doctors in the ER weren't getting their results within that 30 minutes to 45 minutes. So we ordered a CT head without on its own, completed that study, alerted the radiologist that they had a stroke head to read, and that sped up our times so much faster. The ER staff now comes down, they start the IVs in the room, so we don't have that delay in the ER either. They do all the lab work in the room while the without head images are processing. And it's really worked. We've really improved our time.
Well, the raw data from 2022 shows that in Q1, the order to radiology read was met 43.9% of the time with a population of 42 patients. Q2 was met 86.5% of the time with a population of 53 patients. And Q3 was met 97.1% of the time with a population of 42 patients.
So it just goes to show that the process is like a well-oiled machine, that the physicians, CT staff, and the nurses all work together wonderfully.